Hello everybody, my name is Dr. Jason Hoyam. I'm the creator and founder of OnlineExodontia.com. Today I'm going to make a walkthrough video for you. It's going to be a little bit longer video. That's okay, I'm going to chapter it out so you can skip ahead to maybe the pieces that are most interesting to you. And from there, hopefully you'll have enough information to move ahead and make a decision as to whether this is something that you feel would benefit you down the road. This is a course that I've been working on for the past decade. Back in 2016 was when I started to build it. I built content every time that I had a question in clinical practice. What that allowed me to do was very early on when I was starting, I could identify all the gaps that I came out of dental school with. And surprisingly, or maybe not surprisingly, but interestingly enough, what I've found over the past decade is that a lot of dentists are approaching me with the exact same questions. And it's because dental school has been structured a certain way for many years. And some of it is just because it's the way it's always been done and nobody has bothered to change it. And some of it is maybe just the limitations of academia and, limited reps and limited exposure to the real world. This course is an attempt to bridge the gap between what you got in dental school with real practical, tangible information that's going to make you way better at taking teeth out very, very quickly. And I've been helping dentists all around the world, now well over 1,000 dentists who have gone through this program. And overwhelmingly, it seems to be a very positive experience for the people who do. And I know that it will be a positive experience for you too if you choose to do it. The reason that I know that is because the information in this course is essentially me distilling down everything that I've gone through from the time I started my career till where I'm at now, and I've compressed all that knowledge into a guided pathway that will help to build you into the position that I'm in now, which is being able to take out teeth that I never thought that I'd be able to take out when I started dental school. You're going to learn topics that are basically discussed in maybe 5 minutes or less. That was kind of my target from the beginning. Give you the information that you need in the shortest amount of time possible. When I came out of dental school back in 2012, I started in private practice, and I kind of felt a little bit intimidated getting out there because it was the first time that you had to think on your feet and act for yourself and make decisions. And if something didn't go right, you needed to get yourself out of that bind. And thankfully, I was surrounded by some very experienced dentists who were willing to help me. And I know that there was at least a handful of times where I was digging at teeth that had broke off and it was taking forever, way longer than it should. And I had no other recourse. I got to the point where I would be working at the tooth and you're going through your mind, what's next? What's next? What am I going to do? And there was nothing there. I didn't have any other moves to do. I just kept poking, with my elevator, doing the same thing over and over, trying to get this tooth out. And it wasn't working. What do? Well, you pack up and you go get these dentists to come help you and bail you out. Now, thankfully, like I said, they were there, but a lot of people maybe don't have that luxury where you're out working on your own. You've taken on a case that perhaps is over your head or something goes wrong that you didn't expect. And now what? That's what this course was designed to do. It was designed to try to remove that helpless feeling that people have, that lost feeling that you get when a tooth snaps off, and try to guide people from that early stage to know what to do when these things happen. I'm going to teach you in this course so many tips. This is a CE aggregator, I call it. It's the culmination of everything I've learned from all the CE I've done, all the extractions I've done, all my own experiences, things that are in the textbook, things that are not in the textbook. I swear there's a few things I've even invented that actually work really well that I'm not sure are even techniques, but I'll show you in this course. So it's not just theory, it's not just information, it's stuff that really hits home and allows you to produce more, practice more confidently, and basically elevate the standard of care that you can offer your patients. Who is this course for? Well, this course is for people who are new to dentistry. Definitely, if you're a new grad, this is worth its weight in gold for sure. You're going to save so many years of trial and error and frustration and stress if you just go through this course. You're learning from my mistakes, right? You're learning from the things that I didn't know that, quite frankly, thousands of other dentists around the world also do not know, because it's just how dental school is structured. People come out not knowing the basics. So it's crazy, right? So the most common questions that I get are, what instruments should I use? What are the best instruments? How do I raise a flap or elevate a flap? What do I do when a tooth breaks off and I can't grab onto it or I don't know where to elevate? This is the stuff that happens a lot when you're extracting teeth. This should be the first lesson in dental school, and for some reason it isn't. And there's a lot of things that way. This course dives into that for you. It's great for people who are out in practice a few years. This is probably the group that really benefits from this. you've had a few years under your belt, you kind of understand your limitations, you've got some frustrations, and maybe you want to get more proficient and more confident. And even maybe you've been at it for a lot of years, but you just never really focused on extractions and you just kind of always muddled through them and got through it. This would also be for you. But basically that group there, it can take you because you know enough already to really appreciate and understand what you're missing and to really appreciate and understand what I'm teaching. That will elevate you so quickly you won't even believe it. I've got people who are messaging me, thanking me for the content because it's allowed them to now take out third molars or more complicated surgical extractions that they used to refer away. Another group of people that reaches out to me quite frequently is a group of dentists who have been practicing maybe 10, 15 years, and they've sort of hit that plateau where it feels like C is tough to find. They'll wonder, is there anything more that you can teach me? I want to take on more challenging cases. I'm already doing third molars or that kind of thing. What else is there to learn? If I found a tip or a trick or something interesting, it's in a video. There is not a more complete course out there that you can possibly take. You're going to take away so much information. The course has lifetime access. You can refer back to it anytime you need. So if you have a case coming up and you want to quickly reference back to how should I section this or what should I do with this tooth, you can go back and look at it. And that's highly valuable. This isn't a course for people who just want to sign up and get a few credits and watch a couple videos here and there. It's for people who are serious about getting better at oral surgery. If you're serious about it and you want to learn and you want to get better, then yeah, you need to apply yourself a little bit. You have to put in the work. I've dedicated the last, 10 years of my life or more to digging up stuff from all different sources, videos, forums, textbooks, shadowing surgeons, going to courses, reading journal articles. I've done it all. And I've tried to pull out anything that was useful, relevant, tips, tricks, things to make your life easier. There's a lot of people who contact me and they wonder, is this course a course on third molars or is it an extraction course or what is it? It's a massive course. It's everything. And I actually call it a clinical reference. It doesn't necessarily have to be a course. You don't have to go from point A to point B and go through all the videos and complete it to get better. With each topic being only a short amount of time, it allows you to go in and address the pain points that you're having in your clinical practice. Maybe you're struggling with suturing. Maybe you're struggling with managing a sinus complication. Maybe you're struggling with sectioning wisdom teeth or laying flaps. There's videos for all those things. If you're someone who's looking for third molar training specifically, yeah, it's a course in third molars as well. There's a ton of stuff in the previous modules that will help you as far as like patient medical conditions, complications that can arise, infections, the list goes on, right? That all applies to third molars, but there's also a huge component of third molars. I've got tons of case studies where I go through radiographically what you would do with different cases. I try to break it out into different levels of cases, I would call them. It's kind of hard to say that one case is easier than another from a radiograph. For learning's sake, that's kind of what we did. There are tons of patient factors involved, making cases harder or easier, or that kind of thing, and it goes way beyond the radiograph. What we do is we look at cases and we look at, okay, which ones are good ones to start with, which ones could you then progress to possibly, which ones are more advanced, and then maybe which ones do you want to kind of try to stay away from as a GP, unless you want to live dangerously. But what I've learned in my career is sometimes it's better to pass and sleep well at night versus doing something that, afterwards you maybe regret. I've done that many times. I've thought, partway through a procedure, why did I agree to do this? I should have just sent this away, right? And I think we've all been there. But the goal is to not have that feeling as much and begin to take on the appropriate types of cases. So is this a third molar course? Is this a non-third molar course? What is this? People sometimes will ask me and they want training on third molars. There's so many people. First off, if you're brand new to dentistry, like I get emails all the time. I want to take out impacted third molars. And it says question I ask is how long have you been at this? And people will say 1 year, and I felt the same. I really did, because you get out and you think I could do this. There's nothing wrong with that. Really, truly, you need to progress and get some skills under your belt before you start doing some of these procedures. So you can get into a lot of trouble doing third molars. And I don't just mean legally or with patients or something like this, but it's just you can get lost really easily back there because it's harder to access. It's just things are different. The angles change. Healing's different. Complications are greater. Just the stakes are higher, right? So there's a false sense of security sometimes because you don't know enough about it. And you start doing cases thinking, this is great. I remember specifically watching one time, and this was after I'd been doing third molars for quite a while, probably a couple of years, and I watched a video from an oral surgeon, and he was splitting a tooth, and all of a sudden blood started like pouring out, and I was just like, oh my gosh, like it sounds stupid, but I didn't really think to myself that that was a possibility. And I actually, my heart started pounding watching the video. That's how much it hit me, because I just thought, wow, I've been doing this. Thank goodness that hasn't happened to me, because I wouldn't have a clue what to do, right? And that's, I think, the position that a lot of people are in. And as dentists, a lot of times we get lucky because the mouth heals well and cases go smoothly, even though maybe they shouldn't, right? And yeah, we want to make sure that we're not putting ourselves in that position. So that's not my goal. My goal here is to help you identify stuff that's going to be safe, easier, within your boundaries, and allowing you to practice confidently and successfully. One thing I get asked very commonly is, am I actually going to learn from an online course? Can I just look at these videos and suddenly now I can take out these teeth that I never thought I could? The answer is yes. This blows people away. They always think, I got to go to a hands-on course. I got to like sign up and do one of these things. One of the most eye-opening experiences for me, and it was when I did IV sedation training. I went to this sedation training, and it was pretty intense. It was over several weeks. We treated 20-some patients, 23 patients, something like this, where I did the IVs and the titration and the monitoring and all the treatment and stuff like that. My team was with me. And what I realized afterwards, we completed that week, they sent us home and they're like, yeah, you're good. You can go do sedation now, and good for you. And I thought to myself, holy smokes, in that whole week, I don't think anybody ran into any trouble. You get this false sense of security. You know, you put the IV in, you put the drugs in, and you do your thing, and it's all fine. But what happens the first time that you have a patient who has a laryngospasm? Or what happens the first time that you overdose somebody and they're getting way too sedated and they're having trouble breathing? There's none of that in these courses. It's the same thing when you go to a third molar course, for example. So you might sign up, you do this live course, you're jacked to do it. You've spent like 10 grand on tuition, and now you're sitting there and you're doing maybe like, 8 impactions. The cases have been curated and selected for you so that they're not crazy cases that are out of your league or things that you shouldn't be doing. You have a surgeon or somebody who's watching over you, helping you, telling you what to do, and you go through the motions. And yeah, it's good to like feel, what you're doing back there and stuff like that. But really, it's a limited number of reps. And when you're done, are you going to have any issues that arose? Maybe, but probably not. What happens when you get out in private practice and you start doing this now with your 8 extractions that you've got under your belt, and you run into a problem? You've got significant bleeding, or you have some crazy infection or some weird post-op thing that you can't even really tell why it happened or what's going on. These are the things that you need the information for. So that's what this course is for. Where the real benefit is understanding what to do when things go wrong. How deep is your pack of tricks when something doesn't go the way you want it? Tooth breaks off. Okay, now you're gonna reach in your trunk and pull out your next tool or your next trick that you know to get this fixed. And then that doesn't work. So now you go plan B, plan D, plan E. The longer that cascade is, where you have more and more ideas of how to solve it, the more prepared you're gonna feel, the more confident you're gonna be, in the more cases that you're gonna be able to do. Trust me on this. It's the same thing if you go to a hands-on course with stone models or perhaps 3D printed models. You're not really experiencing what it feels like to be in a patient's mouth. You're not struggling with access. You're not struggling with visibility. You're not working on tissue that feels lifelike. A lot of times there's no gingiva or anything like that to manage. There's no bleeding. The patient's not nervous. They're not phoning you at 8 p.m. after because their face is all swollen and they're not sure what to do about it. These are the things that you'll take away from this course. I always thought the opposite. I always thought I need more of this like in-person hands-on training. That's what's going to move the needle. It's not what moves the needle, and that's why my focus has been so intensely put on gathering information and building this clinical resource for people, because I've seen firsthand that that is what moves people ahead in their practice and makes them better. When you sign up to the course, whether you're on a monthly payment plan or you go with the full-on one-time payment, you're going to get a bunch of stuff. You're going to get over 800 videos or whatever at the time that you're watching this. You're going to get lifetime access, meaning there's no expiry. You can go back and watch it anytime. You've got access to the course for all future updates. Anything that I add into it, changes that I make, updates that I make, you'll have that. And if you sign up and want, you can get the whole kit of X-TRACT instruments for only an additional $500, which saves you a ton. So oral surgery instruments are crazy expensive. They don't need to be, right? So I've got FDA approval and my own distribution network so that we don't have to go through distributors. That allows me to bring the cost of instruments way down to hopefully pass some of those savings to you and let you do some of these procedures a bit easier. People always ask me about mentorship, so you get one-to-one mentorship, I call it, which is basically you can email me anytime. People can pass on radiographs to get questions answered about how you would plan a case, maybe what tools to use, a problem that they're having that they might need some help with, or questions they have about a certain technique for injecting or something like that they're struggling with. These things can all be answered through email, and I'm happy to do that because part of my enjoyment in life now comes from helping other dentists, and it feels good to make a difference and help people overcome some of the challenges that I had early on. You're also going to get access to consent forms that I use. There will be medication kind of dosing sheets, sheets that I give to patients for post-op stuff and the drugs they should take before and after. And you'll also have access to a list of journal articles that I found as I was building this course that are just PDFs online that can be downloaded, but I've kind of brought them all into one place. Don't really have to read them. If you just watch the course, you'll get the gist of it. But if you're somebody who likes to go in and look at stuff in more detail or have some kind of resources to show where the information came from, that's there as well. I've got 3D printed models that you can download and print yourself. I also have a component to the course which is called the Core 100 Fast Track. So the Core 100 Fast Track is a selection of videos that I've made from within each module that basically distills this whole course down into like 100 videos. Now, it doesn't cover everything that I've touched on in the course, but what it does is it's helpful for people who look at this course and they say, man, I can't do 800 videos. I can't watch all this. I don't have time to do that. That's where you'd start. So the Core 100 is the things that you see most frequently in practice. It's the stuff that you struggle most with, the stuff that I always get questions about. For example, in the medical history section, I have videos on, say, osteoporosis. Now, it's good to be able to identify that on a pan and know some things about extracting in people who have that condition, but you don't see it a ton. What you do see is people who have diabetes or people who have heart issues or high blood pressure. The videos that are in the Core 100 are geared more towards that kind of stuff versus the more kind of fringe things that you see that you need to know about and be aware of, but you don't see it as frequently. Another example would be like, how do we make a proper flap? How do we trough bone and deal with root tips? How do you prevent breaking teeth and how do you recover from that situation? What are some of the top instruments that I use most frequently? So I have a whole kit of instruments, but there's some that I really lean on for pretty much every procedure. That's in there as well. You'll get a good overview of the things that you need to know. And then from there, I mean, you got lifetime access. You can dive in anytime you want to go back and kind of refine different areas, get better, build on those skills, but you can address the core stuff first, which is why I call it Core 100. More recently, I've developed oral surgery instruments that are a curated set of instruments that I use daily, and I have for years, that basically match up to the trainings. One thing that I noticed is, again, I would get people go through the course and they'd say, you know, I don't have this tool, like what would you recommend? Or my office doesn't want to buy me this, or whatever it is, right? What I've done is I've included the kit with the course, so now when you sign up, you get all the tools that I use. Every technique, everything that I show in the course, you can actually do it. There's no barrier to getting started. The friction is removed, and it just makes translating what you learn in the course much easier to taking it into the mouth chairside with patients. At the moment, you get 56 AGD PACE credits for taking the course. They are self-study hours, so it's not a live course, it's all pre-recorded. So once you complete a module, you will get sent a certificate of attendance. So basically, that's how the CE is issued. It's issued at the time that you complete the module, and it will give you a certain number of CE hours based on the number of hours in that module. I'm going to walk you through the user interface here in a minute and show you how the course is built inside, how it's laid out, and kind of how you might choose to use it depending on your preference for learning and that sort of thing. This is the main page. So you log in, you see this here, and basically it gives you a landing page that lets you then navigate to whatever module you want to navigate to. It kind of tells you how many lessons are in each module. As you can see, it kind of follows a bit of a progression. So at the very start, I've got Core 100. Got 99 lessons. I don't know, maybe I missed adding one. I'm gonna have to check that. So it should be 100 lessons, and I might just be displaying differently. But basically, yeah, you have 100 lessons here. This is the one that would teach you kind of all the main stuff that you want to learn about. So if we click over here, This will expand and it gives us a list of all the lessons that we can see. And it's the stuff that you run into most commonly. We got ASA classifications that just kind of gives you an overall look at people's health to see who you could be treating or not in your office. Hypertension, diabetes, some of the things you commonly see after extraction. You break a buccal plate, got bone chips, dry socket, sinus issues. I go through some of the things that people like to know about, which would be how do you manage pain, what do you use for that type of thing, and yeah, blocks. People struggle with blocks all the time. It's a great place to start, and again, if you don't have a ton of time, you can fly through this and you're going to be way better at extractions and just dentistry overall after taking that course, or that module I should say. Next up, so after that, again, you can collapse that down, and you got anatomy and biology. It just goes through some of the main landmarks, nerves, blood vessels, things like that you need to be aware of, and it helps you a bit to kind of visualize what a dry skull would look like. When I was in dental school, we did cadaver dissections, and we looked at everything but the head and neck, which is totally crazy because that's the only thing we should have been looking at. But I remember looking at kidneys and femur bones and whatnot. I don't know, it was interesting to see, but not super applicable for dentistry. We should have just spent our days looking at every inch of the jaws. But anyways, so this is a look at kind of what a video would be like. It's just a tabletop model. I go through and kind of demonstrate, like, you know, where's the lingula, what's the, you know, typical course of the nerve, the accessory innervation, all that kind of stuff that you'll find out about, okay? Into medical considerations, looking at all the things that you run into in your practice. So sometimes you have questions like, person just had a heart attack X amount of time ago. Can I treat them? Do they need antibiotic prophylaxis? I have a pregnant patient. What should I do with that? These are all topics that, again, I kind of keep up with. I have an AI auditing system that will go through my videos, point out anything that, you know, maybe needs updating from standards that have changed. And that's all included in these videos. You'll see down here, so we have this here, which is downloads. Each video, or the ones that I guess benefit from it, which is quite a few of them, have what is called a clinical companion sheet. The clinical companion allows you then to download it, and it gives you a written overview of kind of the key points in every lesson. It's a very quick way to reference back. Maybe you're looking at antibiotic prophylaxis and you can't remember the exact rules for that. You don't have to scan through the video to find it. You can just click on the little PDF download and it'll list it out for you as to, you know, the things that you need to know. Next module is surgical complications. You will see complications. I mean, it's the same as every other discipline in dentistry. The more of something that you do, the more likely you are to see a complications. One famous saying that I've always heard in dentistry is, if you haven't broke a file, you just haven't done enough endo. And it's true with extractions too. Like, if you haven't perforated a sinus, you haven't extracted enough teeth. If you haven't broken a buccal plate, same thing, right? These are things that are going to pop up. And again, this is the stuff that's going to make you better as a practitioner if you know how to deal with it. And you have this straight up video that you can look at. So patient comes in, they've got a giant purple blob coming out of the tooth extraction site. It's a liver clot. First time I ever saw that, I didn't know what was going on. I had no idea. I'd never heard of this. I didn't know what it was. Didn't know what to do with it. And it sounds silly, but it's true for a lot of people. You've got all this stuff that you're going to be exposed to, hopefully before you find it in your chair, and you're going to know instantly, like, yeah, right, that's what we do with that, or that's what that is. Lots of cool stuff in there. If we continue on, module 4 has infections and fascial spaces. This is more of a fly through. It's definitely a description of kind of how infection spreads, how you would triage infection. You know, sometimes you see a patient in your chair, they're really swollen up somewhere and it looks pretty bad, you know, from the outside. But, you know, what makes that more or less concerning? When would you want to dive in and do something right away? When might you kind of, you know, act a little bit and monitor them? How aggressive should you be with your treatment? Should you send them straight to the emergency room? You know, these are questions that we have in our minds that we don't always have a clear answer for. This module aims to kind of address that by allowing you to understand which spaces are a little bit more high risk, where infection generally travels throughout the mouth, and sort of how you would deal with it, right? Either through prescriptions, incision and drainage procedures, stuff like that. Next up is diagnosis and planning. When you look at a radiograph, how do I know that this might be a difficult tooth to take out? What kind of things am I looking for in the root structure, in the density of the bone, in the PDL space? the root curvature, divergence and convergence of roots, all that kind of stuff. You'll get better at kind of developing a plan in your mind, and that's one of the key things that I teach here, is having a plan before you get into the extraction. Early on, what I found was I was reacting to what was going on. I would grab what I thought looked like a good instrument, I'd try it, oop, didn't work, right? And so now I'm reacting. I'm going like, well, now what? Now, what should I use? Whereas later in my career, I would look at a tooth and I'd say, okay, there's decay here. Likely this is going to break right here. And when that happens, or if that happens, this is what I'm going to need. This is how I'm going to handle it. And that way too, your room usually has everything that you need set up in it. And we talk about helping your assistants to kind of follow along and understand these things too, so that they know how to set up your tray. And basically from there now, it's not you reacting anymore. You're controlling the procedure and you're feeling more confident and more calm as you proceed through it. Drugs and materials goes through common pain medications. I touch on things like gel foam, Colaplugs, Benecel, hemostatic gauze, different kind of adjuncts that we might use to help us out with our patients as we're working on them, to manage bleeding, for example. In these cases here, we're talking about actual specific patient drugs like warfarin, Plavix, different things that people are taking now more commonly, I guess, the direct oral anticoagulants that you might see, Pradaxa or something like that. One of the things that used to be taught years ago was to have people stop taking blood thinners. Well, a lot of times that's not really the case anymore, right? And that could put patients at risk. So there are things that we need to know that sometimes are perpetuated throughout teaching that have changed over time. It will help with how safe you are and how you can look after your patients. The next module, this is a huge one. So local anesthetic. I spent a ton of time on this module, and I've actually got a breakaway course from this that goes into just local, demonstrating injections and things like this. But basically this goes through all the different injections that you can use. If you know a whole bunch of ways to get a tooth numb, your life is going to be easier. So one of the challenges again with extractions is sometimes you're working, you've all been here, I'm sure, you've got the tooth partway section and all of a sudden the patient's like, oh, and they're in pain. And you're going like, oh my gosh, like we've been working now for a while, you haven't felt anything, and now it's hurting. And you're looking around and it just looks like a bomb went off in the surgical field and you have nowhere to put your anesthetic, or you don't know what to do next, right? So this is going to help to address those kinds of things. How do you get people more numb and comfortable prior to the procedure so you're not re-anesthetizing them? What are the most common ways to supplement your anesthetic? What do you do when there's infection present and you're trying to anesthetize a tooth and it isn't really working? Patient comes in with a swollen face and a hot tooth. Now what? That'll all be covered, along with tips for better injections, more success in your injections, and some of the armamentarium as well for that. Looking at instruments, so again, I'll show you a whole section in this with the X-TRACT kit and the tools that I use. But basically, again, this runs you through the kind of ins and outs of each instrument. Sometimes why they're designed the way they are, maybe the best uses for them, ways to handle them, hold them, apply them, and get the most use out of them. So an example might be a cryer elevator. That's become one of my favorite instruments. Initially, I was trying to use them. There was a few problems I had. One was it was super dull. I'd been there for 30 years in the practice, and I was just using this dull triangular thing that wasn't even a triangle anymore, really. It was just like this smooth ended thing that wasn't engaging the tooth, wasn't doing anything. And I kept asking myself, what am I doing wrong? I can't figure this out. And really, it was just the tool wasn't super sharp. And there were some other things about the angles I was using it on and things like that that could have made it better. But stuff that I point out in these videos that, again, you may not be thinking of, that is going to help you to get better. Again, there's quite an extensive list. I cover a lot of things, even stuff that isn't in the kit, stuff that I've seen or used that I've liked in the past. Everybody has access to different instruments, so sometimes there might be some on this list that you have in your practice that you might like. We talk about isolation, tips for that. If you can see really well, so I always say there's three things. There's light, access, and visibility. If you can master those three things, your procedure got way easier, and that's because you can see it. To do well what you see, you must see well what you do. And so, yeah, that's something that we look at here. Surgical technique, that's module 9. This is kind of the crux of everything. This is the thing that people can dive into that's going to really help. How do I sit the patient? How do I hold the forceps? What should I do as far as applying pressure to the scalpel or the forceps or the elevator? What directions should I use when I'm elevating, or what angles should I elevate from? All these little intricacies that maybe get glossed over in other courses are covered in here to make you more effective and efficient with your tools. How do you make purchase points, incision and drainage, flaps, everybody's interested in flaps, bone removal, troughing. I cover everything in big time detail with that. Extracting specific teeth. So believe it or not, I mean, when you approach teeth, there are motions and movements that work better with some teeth than others. So it's not all just like lean to the buccal and lean to the palatal. I mean, that can work, but there's other ways of doing it that can help in specific instances for specific teeth. So I kind of go through each different tooth and I tell you the instrument that I like for that tooth that's generally most successful. I tell you the approaches that I use that are generally most successful, what to do, you know, maybe if they're difficult to get out, so say like a maxillary canine, that's a common one. If you're trying to do that and it doesn't go properly, what can you do? And this extends into pedodontic extractions. If you're not taking out primary teeth, I mean, probably you could do that at the very minimum. Perio teeth, primary teeth. These are easy extractions. Again, the kit comes with tools to allow you to do that. But yeah, it'll walk through, again, mixed dentition, kind of showing you all the primary teeth and the movements and the tools that allow you to extract them, along with tips for how to manage the kids and get them numb and help with supporting their jaw and things like that. Suturing, very common issues. People are slow at suturing. I'm still slow at suturing. As time goes on, you get better at, you know, avoiding the things that trip you up the most. This section will give you all the common kind of tips and tricks that you can do to get better at suturing. Over time, what I've done is I actually suture by hand now. And I looked at, it was a cardiac surgeon, and I thought, wow, why is this guy hand tying his sutures? And I also saw an oral surgeon who did this, and they were lightning fast with their sutures. And I was so jealous and intrigued by it that I had to learn it. And when I learned it, I thought, man, this is way more efficient and it's easier and it just feels cool when you do it. So it's a good skill to learn, and I teach that in this course so that you can get faster and better with tying your sutures. Go through the different types of sutures, like stuff that maybe you've never even thought of, like a locking horizontal mattress suture. I didn't even know that was a thing till I was researching for this course and learning about sutures. Stuff that you can employ that's actually really easy, just little modifications to your current suture process that can make them even that much more effective. Clinical tips and situations. This is one that I put together. It's kind of a mixed bag, so it didn't really fit in other areas, but you know, you look at this buccal and lingual decay. So this video talks about what happens when you get an upper molar, and you know these ones where you reach for your forceps, and this happened to me early on all the time. I'd reach for my forceps, I'd go to grab the tooth, and it's just like, it just like squishes into this buccal decay, and there's no tooth there. You can't physically grab anything. It's decayed so badly, or under the bone or something like this, that the decay is gone. What do you do with that? These are things that are going to teach you how to overcome these common scenarios that you don't find in the textbook. The textbook just shows you the perfect scenario every time. You've got a molar that's divided into 3 little pieces, and then you've got the picture of the elevator with the squiggly lines, and it goes in and everything comes out. And it's all good, right? But in reality, that's not what happens. This is for those kind of situations. Malaligned teeth, what happens if you go to grab a tooth and you can't even put a forceps on it because the patient's teeth are like all bunched up, or you can't move the tooth the way that you normally would because something's in the way, right? There's a tooth in the way. These are things that we need to know. Endodontically treated teeth, people struggle with those all the time. Yeah, so lots of stuff to know in these ones, even situations, again, that maybe you've never heard of or thought of. Down here, so this is kind of everybody's favorite section. So people are always into third molars, which is great. But again, you got to be smart about it. This is very detailed. I start out with the mastering impactions section. Mastering impactions basically goes through the theory of third molars. So it covers how do they develop, you know, what age do we expect to see them on a pan, when do we want to remove them, why are they sometimes not there, what happens to the follicle, yeah, different things. Prophylactic removals talks about the AAOMS position statement and third molar white paper. Those are super critical. If you've never gone through the white paper, that's key reading for third molars. You need to understand that to allow you to make good decisions with your treatment planning. It goes through, again, the reasons why you might extract these teeth, reasons why you may not extract the teeth, and kind of the risks and benefits of both of those. I go into classification systems, so ways to kind of look at radiographs as far as how do you know if this is going to be more challenging or not. Basically, it comes down to tooth position and bone removal. Those are kind of, some of the things that you're looking at. There's more beyond that, like the type of patient you're working on, the access in the mouth, and all these kind of things. But this is purely from like a radiographic perspective. How might you analyze a case? People always want to know, how do I know if it's safe to take the tooth out? So these are basically videos going through what you look for on a pen, or sometimes even a cone beam, like things that you're going to see on a radiograph that's going to make you say, yeah, I don't think this is a great case to be doing, or got to be careful with this. And again, just the fundamentals. So we go through flap design, incisions, troughing, cleaning up the area when you're done, step by step through the entire procedure, so that you have a clean kind of overview of everything before we then start talking about specific cases. Case studies, this is specifically module 14. I just call it like chalk talk. So if I click on this and this page loads up for us, it'll show you basically it's just a radiograph and I do a voiceover on it. So I go through and I can illustrate on here the things that I would look at, think about as I'm analyzing the case. How would I approach it? What instruments would I use? So we talk through the entire procedure as though you'd be thinking about it prior to doing it, okay? And the idea behind that is to make you start to think about a plan before you get into a case. So understand, what am I going to do before I take this tooth out? What instruments do I need? What surprises might there be? What challenges am I going to face, either, pre, post-op, intraoperatively, that kind of thing. So by the end of this module, you're going to see all sorts of things. So this is one talking about this guy here. So there's a mesiodens blocking the eruption of this tooth. If you were to remove that, how would you approach it? I've got cases here. You've got, failing bridges. You've got sinus proximity, teeth that are cracked in half. All the stuff that you'd see in private practice that, again, in the oral surgery in school, you don't sit down and go through a lecture on, okay, this is an endo-treated abutment on this 5-unit zirconia bridge, and it's connected to 3 other teeth. Like, how do we deal with this? That situation just wasn't talked about in school. So I tried to get a good sampling of different things that I see in practice that you need to know how to deal with. And there's a good overview on all that. Then we move into third molars, and I've got them organized into like level 1, 2, 3. So these are radiographic case studies. I'm going to walk you through the entire case. I've got pans on a lot of these patients that basically over the years, so these are long-time patients, we look at what did their teeth look like when they were 10, and then what they look like when they were 15, and then now what's it look like when they're 19. And you can actually see the changes to the third molars, which is kind of cool. I blend it together in the videos. See if this maybe shows up in here at all, if I can pull it up in this case. Some of them, this guy's is already done. But if there's some of like a younger person, that's essentially what you see. These are good because they start to train you to be like, okay, what are we going to look for in a case that might tell us that, okay, like this is going to be an easier case or perhaps a more difficult case. Might be further along that we start to see level 2s. Let's just try a random level 2 and see if we've got some progression on here or not. It's just kind of interesting because it shows you these cases early on and you can start to see what they looked like and what they look like as time goes on, right? So they've got patient growth that's included, and it gives you kind of an interesting look at cases that you may not get otherwise, right? Good. So then let's go on here. So now it's level 3, third molar. So again, these are cases that are a little bit more involved even than these ones that I'm showing now. So level 2s are like, pretty favorable root structures, as you can see here. They're down a little bit, so you're gonna have to make some incisions, maybe remove some bone or do some sectioning. Level 3 is, you have to remove bone, you have to section, teeth are covered up or fairly deeply impacted, right? And even some of these are higher up. You look at this guy here. Anytime you're going to take these out, you got to look at where you've got to get to on the tooth to get it out. So you got to elevate up here, which is pretty high up. And access can be tricky on these, especially when these teeth are kind of tipped back, those second molars. Stuff that we go through that is good to learn basically before you get into it. 4K clinical cases, this is the one that people love. They love to watch actual surgery. And so, again, everything up till now has kind of been building the fundamentals and teaching people the things that they should know. And then it kind of gets brought together in this clinical video module, just showing you exactly what I talked about. You're going to see the instruments, you're going to see the techniques, you're going to watch me do it, and it's going to start to click and make sense with the things that we talked about. Okay, so I've got pediatric cases. The way that I tried to do it is I tried to kind of grab, you know, videos of kind of each situation, so like each tooth, right? So like maybe you have a case coming up with a kid who's got a lower left first primary molar that's got to come out. There will be a lower left first molar, so here, so LL first molar, right? You can watch some of those cases and say like, okay, yeah, I see what he's doing for this, and then you can go and do that case yourself, right? So you've got an upper canine or something like that. Here you are, you've got upper canines. You can look at that. That's common for making space in the mouth. After the pedodontic section, we've got basically simple extraction sections. You can see on the screen here, it shows an example videos. This is basically a orthodontic case. You got a first premolar that's coming out. This is organized the same as the pedodontic section, where I tried to get a video, at least one video of every tooth in the mouth, so that you can kind of reference it if you have a case like this that's coming up. So you can go through and you can pick any of those. These are essentially cases where I used an elevator and a forceps, and that allowed me then to remove the tooth. Tons of those. And then surgical extractions. This is again what a lot of people are interested in, because this is where we struggle. We need to learn some tips and tricks about how to remove teeth that break off or that sort of thing. Again, all these organized in order, basically to allow you to find different scenarios where the tooth was removed surgically. I've got some clearance cases that are a little bit more involved, where I'm taking out multiple teeth at one time. And then the third molar section here. People always wonder, you know, what's in the third molar section. There's, I think, about 100 live videos of third molars. There's all sorts of scenarios. Erupted third molars, lots of those where people come in just to have one or two taken out. And then there's other ones here that are a couple per side. And then you've got these level videos which kind of match up to the training that we did earlier with the radiographic analysis of the level 1, level 2, level 3. I kind of show some of these cases. These are ones that you can watch, and again, there's lots of these to go through. I show the actual cases themselves, and then I actually show the post-ops as well. So that's something that I find interesting, because a lot of courses you don't usually see that, and that's a big part of it. So you take the teeth out, and then you have to kind of look after these people until they heal. And sometimes you see afterwards something that you're not sure if it's normal or if it should look the way that it looks. You're going to get a glimpse into that kind of thing here with these videos as well. That's pretty cool. What's our other bit here? Platelet-rich fibrin. This is actually going to teach you PRFs. If you have any interest in doing PRF, you'll actually be able to do it after watching this module. And you'd have to check to make sure that venipuncture and stuff is okay where you are, and there's no kind of regulatory stuff around that. But as long as that's okay, you could implement this in your practice. So that's another service that you can offer your patients. It's a great thing to offer. This will teach you all about everything from start to finish. So what tools do you need? How do you do it? What are the protocols? There's different protocols out there, but this teaches you a few different protocols. By the end, you'll be able to make plugs, membranes, sticky bone, and you'll know a little bit about how to utilize the PRF in your practice. Socket preservations. This is nothing wild, but when you extract teeth, this comes with the territory. So sometimes you're taking a tooth out because the person's going to put an implant there later. You need to know how to prepare that site, how do you preserve the site so that you don't lose the bone in that area. Or perhaps they're going to put a bridge in and it's an aesthetic area and you want to kind of keep the bulk of the bone there for underneath of the pontic. It's a great module for that. We go through basically the types of grafting material, classification of sockets so that you understand when you might graft, go through the technique of it, and yeah, what to expect for healing and all that sort of stuff. So by the end of this module here, you'll be able to do basic grafts, so you're not doing anything crazy, but you know, you can definitely do some basic socket preservation to build up some areas to help you with your implants or your bridges or getting better outcomes for patients. I got these 3D printed third molar models I was telling you about. There's kind of one for each situation, and there's a base you can print out too that it comes with. Helpful documents. I've got basically instrument stuff here. I've got post-op instructions, consent form, all these journal articles that you can view as well. And that's kind of a look through the modules. So yeah, it's a huge course again, and it is set up though in a way that it's easy to navigate. You can find what you're looking for right away, and you can refer to it anytime. That's why I said, and even larger case studies, when I worked with DSOs on this, one of the things that they find, and it's the same I find anytime with this course, people utilize this like a clinical reference. They'll go in, they won't necessarily watch the whole course, but they'll watch the stuff that they need. If they struggle with suturing, they'll watch the suturing module, and that's value in itself. This course will pay for itself multiple times over if you go through and you address the gaps in your knowledge, and you can do that in a customized way just because there's so much information here. And again, if you feel overwhelmed, Core 100 pathway, that's the best place to start. You just jump in there and you're going to get a lot of what you need to be successful. I'll show you this case here. This is just a third molar case
here. This is a perfect case to do in your practice if you can find a case like this. So you've got these 4 teeth here. The left side down the lower looks like the roots are still forming.
This is my approach to every case. What I do is I show the radiograph at the very beginning. We talk about kind of the things that you note on the pan that might make it more difficult or things you want to watch for. And then we go into actually showing the procedure.
Close by, but not too much of a concern in this case. And then the uppers, they're a little higher up, I guess. So, I mean, you want to be comfortable doing those before you dive into something.
Now, the other thing you'll notice is I talk slower.
They're going to be pretty straightforward to get
to. If I'm speaking too slowly,
we've got our
you can bump the speed of the videos to 2x.
Then you just want to pull it until you feel the back of that second molar and then swing it up around.
And at 2x, I mean, you can still understand it, but you can get through the content twice as fast. So that's just a tip.
Locate where the tooth is. I like to get down on the buckle of it. The tissue's kind of adhere a little bit there. Yeah, that should pop open easier than it did.
And I will speak critically about my own work too as I'm working. So I just show you everything. So like that one here, like I was struggling a bit pulling that flap off.
Locate the tooth, and I like to wrap it around like that.
You know, and so we talk about why that might be.
Shot to get that out. Again, spade goes up in there. We're getting a purchase on there, trying to pull it out. There we go. Again, we're just aiming as high up on the tooth as we can. I'm trying to lever down, and sometimes they jump out like that, which is satisfying.
So this is all again filmed from a loop-mounted cam. So this is my own
clean up the socket a bit when
sort
you're
of
done
view.
There, if you can get
I try to chop out all the bits where I'm looking away from the camera, and try to stabilize it for you as well. So your head moves a lot more than you would actually expect when you're doing videos. You don't realize
there's the tooth
later.
Right there. You can see it peeking out under that flap. And as I said, want to get our
so again, you just get a good sense of kind of what you want to do with these cases.
Like the other side, that one jumped right out as well, and that's the advantage of taking these out when these people are young. So when those teeth are young and they have an immature root apex, they tend to jump out way easier. And it doesn't take long. So like, you know, the difference between a 17-year-old and a 21-year-old is pretty, I guess, noticeable when you're working on them. Here again, we're just making a little bit of a flap here to access that.
This is a common problem for people, is this little distal lingual bit of tissue. So if you peel it off like that prior to the extraction, that's going to make your life so much easier in a lot of cases.
As we can see the whole tooth there, and we had a shot for our elevator. We just stuck that in to lift it out. Again, once it's lifted, you want to get over to that buccal surface if you can, and back to the mesial, lift it out. There again, look, that root.
So basically that's kind of what it shows you. And then, you know, from there, so the other side, I don't know if I sutured or left it open, but
again, just the plain gut,
it just demonstrates how you might go ahead and close up the site. So it shows all the aspects of it. If we put PRF in, you'll see PRF in the case.
Down, and then, typically,
just essentially shows you start to finish and walks you through the case. So most cases are like that. It's the same for the other modules. When it's just surgical extractions, you'll see me walking through the case kind of radiographically, and then you'll watch me do the case. And, you know, if I tear the tissue, if I break the bone, if the tooth snaps off, I leave it all in there and we talk about it, because that's how you learn. It's not look at this tooth and look at me take it out in 5 seconds. You know, that's great, but that's not the goal of this. The goal is to show you, hey, this is really reality. This is what happens. Teeth break, tissue tears. Here's how we fix it, right? I'm not perfect. I don't profess to be perfect. I'm not a specialist. I refer cases It's just I've done a lot of studying on this, and I've grouped a lot of information together that can be very helpful for you. That's a look basically at everything. So let's jump in and now look at some instruments. One of the things that I offer is a suture pad. So you can click on Suture Pad. This takes you down through here. The reason that I designed this was kind of for fun. I like to create things, and it was also though because suture pads are just slits in silicone. When you find a training kit, it usually looks like these. You've got these little guys here, which are good because you can practice poking into there, but it doesn't really replicate dentistry. What I try to do is I try to make a variety of situations that I could think about that you might come across. So you might come across somebody who's cut their lip open. You might come across a tissue tear that runs through the maxillary region up by the canine. You might have these big flaps that have been elevated or raised. Endodontic, apicoectomy flaps. You've got a biopsy here on the tongue, or you've got a molar site, frenectomy, tori, you name it. There's just a whole bunch of things. Edentulous, ridge, all these things that you can practice on. And is it any better? I don't know. I mean, it's cool because it is more like the mouth. It is more like what you're actually suturing versus just stitching up slits in silicone. You can check that out. It's available on Amazon. If you want to check out the course a little bit, there's two ways to do it without actually committing to purchasing or signing up. One is going to the preview, free preview up at the top. And what it's going to do is going to give you this little video that kind of does like the quick and dirty run through of why I made it, what it's all about. And then here I just pulled out a few videos from that area that I showed you, with the user interface. This shows you, a couple sample videos from various modules in total, so you can check them out. If you like those and it seems like a good style of learning and you want to pursue more, but you're not yet sure if you want to sign up, then you can go here. You can start a 7-day free trial. You don't need a credit card or anything. You don't have to give me any kind of information. You just sign up, name and email, and you get access again to the trial videos. Trial videos is a collection of a couple videos from each module, just again to give you the feel for how I teach. You're going to kind of get that sense from watching this video and also from watching these sample ones, but if you maybe need a little more information, go ahead and check it out. And yeah, basically here it just kind of runs through again who it's for, who it's not for. We kind of covered that already. If we're going to sign up, so let's look at join now. Click up here. You've got these three options. One option is just the course. It shows you what's included, so you can get lifetime access. You've got payment plans available. Payment plans for these, actually, if you go here, you hit get the course, it'll take you to the checkout page. On the checkout page, you can select here, so you can actually do a payment plan instead of the one-time payment for the course. And some dentists like to have cash flow. The other options, I recommend this totally. So it's a digital course plus the kit. You're going to get the kit shown in the picture here. It contains 31 instruments that are all designed around the videos in the course. They're the same ones I use. Again, it's going to allow you to do surgical extractions. It's going to allow you to extract teeth in kids. You can do third molar extractions. Every tool that you need is going to be in that kit. If you like it, it gives you a way to test it too for not very much money. If you like it, then you can buy a new kit. Members get kits for a discounted price. You get 15% off any future kit purchases. This here is an option for non-members. Say you don't want to do the course or you're not ready and maybe you just want some tools. You can buy the instruments on their own. There is a payment plan for the course and the kit if you're wanting that, but you don't want to pay all up front. Again, same thing. You click the checkout, you come here, and now you can choose a payment plan instead of the one-time payment. That's it. So once you sign up, what happens? Say that you want to buy this. You sign up, put in all your information, and you'll get instant access to the course. So the course becomes available in full. Your kit will get sent out to you so that you have it shipped out basically right away. It'll be there hopefully within a week or two, and you'll be good to go. You can start implementing the stuff that you see in the videos. At checkout, I offer an opportunity basically to get a cheaper kit. If you want, you can add it into your order and tack that on the time that you check out. Beyond that, the cost is $16.95 for members. So a little bit about me. I graduated in 2012 from the University of Saskatchewan. I started out private practice just doing general dentistry. I'm in a small place, about 10,000 people where I live. That being said, we serve a massive area. So our practice has close to 9,000 or 10,000 active patients. and there's really no dentists around, like not a lot. Our access to specialists, I mean, we have tremendous specialists, but these guys are swamped and they're far away from where I live. Not everybody wants to travel or go there. So I'm in a position where, there's fewer people to refer to. That's kind of why I ended up doing some of these procedures and learning them. And the other thing is that just I really enjoy them. So extractions are my favorite part of dentistry. I love it. When I teach, I'm very informal. So I don't like formality. I don't like the starchiness of academia. So one of the big things that really changed my life was learning about the Pareto distribution, or the 80-20 rule. And basically what that is that 20% of your efforts or 20% of your knowledge will account for 80% of your results. And that's the key from this course. That's essentially, if you want to distill it down, this is the 20% of stuff that you never got in dental school that's going to give you the 80% of the results. Dental school did it backwards. Dental school gave you the 80% of stuff, which is like information overload, that applies to 20% of what you do today in your practice. And you know that because there's a lot of stuff you did in dental school that you never see, you never hear about, you don't have to deal with. And the stuff that you should know more about, whether it's extractions or crowns or endo, whatever it is, stuff that you didn't learn and you need it. And that's why continuing education exists. Imagine if you could spend 4 or 5 years going through the best CE courses online or in person or taught by the leading people. Think how much better you'd be at your day-to-day practice. You'd be insanely good. There are things that you just can't get in life. And one, I shouldn't say you can't get it, but it's hard to get. And one is experience. And experience is something that you get once you mess up and you didn't know something. And it doesn't feel good, but it feels good later because you learn and you grow. What I'm offering you with this course is a chance to learn from me, because I've been out now practicing for quite some time, and I've been through some experiences that sucked because I didn't know what I was doing. I messed up, something went wrong, and it made life stressful. And it was difficult because I didn't know the answers. But I found the answers and I put them together, and hopefully, if you want to take the time and make the commitment, you can join this course, you can learn them, and you don't have to then experience the things that I experienced, and you can go through and live a more calm, comfortable life in dentistry off of the back of me, who had to suffer early on to learn these lessons. So the trial and error for you doesn't have to exist like it did for me, is what I'm getting at. And it's a small investment of your time and money that will do that. And I'm here to help you every step of the way. I would love to work with you. If you want to work more on an individual level through email, whatever, to help you get along, that's great. Investing in this course it's an easy decision, really, in from my point of view, because I know what's in it and I know what it's about and I know how it will help you to advance. It's not a huge investment. It feels like it. It can feel like it, but you got to think about the value that you're going to get out of it, the standard of care that you're going to bring to every procedure. And this is an interesting point, actually. I noticed this in my own career. When you get better at surgery and you start doing more difficult cases, so like, for example, when I started doing third molars, it's tough. It's hard to see back there. It's tricky with the angles and getting your handpiece in, and you got to really focus, and there's a lot more kind of going on. When I got out of there and I started doing, say, like a crown again on a lower first molar, holy man, it made it easier even than it was before. And it's just because you're used to working in tougher conditions. It also takes you in this mindset of, hey, I can do that. Why can't I do this endo on this tooth? Or why can't I do an Invisalign case? There's these little bridges that sometimes we are afraid to cross because we're not quite confident, we don't believe in ourselves. But once you start doing surgery, man, that unlocks a lot. And I know that from my own sort of progression through developing my skills. One final point that I'd like to make is something that I picked up from it was an oral surgery course that I was at, and it was actually from a guy who presented on the last day. His job was basically specializing in failed implant cases. I can't imagine the stuff that he was tasked with fixing or doing. But one of his comments, and I was quite young when I heard this, it really kind of changed my mindset almost instantly, was he talked about investing. And he said he learned early on that one of the only things that's guaranteed to give a return is investing in yourself. And that was a very powerful piece of information. And he's obviously done very well with it. And I've kind of adopted that mindset of personal growth, personal development, and investing in myself and my education. And I can tell you firsthand that it works. And so The reason that it works is that when you learn a new skill set, suddenly now you can offer another service, you have another means of earning and producing in your practice, and this course is no different. So I want to thank you very much for listening to me and going through all of this. If there's anything else that I can solve for you or that I can clear up, hopefully I've covered it decently in this video, but if there's anything I've missed, reach out to me. My email is jason@onlineexodontia.com. I'm happy to discuss with anyone any of your needs for education, and I hope to see you soon. I hope to see you check out the site, and I know 100% this course is going to make a difference for you, because I've heard it time and time again, and like I said, I've helped dentists all over the world now for the past decade, and they've all been saying the same thing. So thanks again. Best of luck to you in your future, and I hope you have all the success that you deserve, and yeah, wish you the very best.